can just assume something to happen without. That's why they are different. And the difference between forecast and planning, forecast is part of plan. It's a stage in planning, but itself is not a plan. Because after making the forecast, you need to complement and supplement it with an action plan.
We need to think outside the box to see how we can mobilize a lot of resources, especially to address key issues in terms of healthcare financing. By the way, according to WHO, healthcare finance is one of the building blocks of health system. And without robust financing of the healthcare delivery system, we are going to continue to have a lot of issues. Thank you very much.
My concern is in the area of health financing, especially in Nigeria. Let me not go more than Nigeria. In Nigeria, we just expended a lot of resources doing nothing because the issues were so much in states, high prevalent states like Akwa Ibom, Delta State, where my organization is one of the key partners. Enugu, Imo, those places where the issues were very, very, the prevalence was very high. You are one of those advocates, to the federal government, and you speak to them and they listen. Kindly speak or advise, proper advice to the federal government of this country that we have a lot of wastages in the health sector, that monies can be channeled to other areas and not just one public health disease that we're supporting and contributing so much money and nothing to show for it. Thank you.
Whichever organization you come, you may not be the first person to start budgeting, but maybe along the line you improve the technique, the existing technique. That's why we call them budgetary improvement techniques. We start with incremental budgeting, which in most cases we do it at the level of public based on the macroeconomic realities, based on the existing realities. One of its limitations is high cost of administration and time consuming because you are starting from zero base. Where there is no vision, where there is no goal, you become a goatish environment. Vision, I say, is the picture of the future. A purposeless institution, it's like a very good soup, very good edikaikon, and it has no salt. It is not so much about funding. Some countries, we've gone to some countries, they have little funding than us, but they are doing so much more than us. I say, if you don't want to be corrupt, do you know what to do? You work 10 times better than any other person. When I go to the Nigerian Institute of Management, they told me I cannot succeed without corruption. To contribute less, who are you? You are like the book I wrote in year 2000, a leader or a dealer. You are a dealer. I call it you and I. What does that mean? University and industry. University and industry. If university is doing its own and the industry is doing their own, no nation can develop in that order. He said the best form of development is self-development. Change. All of us need to change. Before we even leave this hall tomorrow, we have to change from one dimension to another, from one limbic direction to another.
Vision is something high. You put it by yourself to be reached at the high level that you would like to be as the leader and to guide your institution to the outstanding standards.
The basic skill and ingredients of a leader is integrity. And as a leader, your integrity will be called to question at one stage or the other.
And the model are so much like that model which he termed ask model.
That model which constitutes of attitude, skill, and knowledge. University versus industry, where the skill section is missing. Because I believe when we look at our degree, I don't know the certificates now, it's awarded based on character and learning. So character is part of attitude. So learning is there, that's knowledge. So there should be skills in between. That's my take. Thank you.
I think basically the problem begins with us, the technocrats, so to speak. The civil service is the problem. All right, this is Professor Mugisha. Please make him feel welcome. All right, thank you very much for coming. And
my name is Professor Hayat Goma. I'm Egyptian and I'm working as the professor in nursing in Ahmadu Bello University. The aim of this one is just to equip the leaders in health system and health professional with the advanced and they are updated knowledge and skills for regarding leadership and management.
I am Wandem Agenyo Alamu. Public health professional. I came here to support the African Institute of Public Health Professional Association to conduct a high-level leadership and management conference, training program. Participants are senior government officials from the countries, different states, and also from the national institutions, mainly public. So one of the things that we wanted to make sure is that the leadership and management competencies are highlighted, and also they are enlightened in terms of bringing change in the way they do business on day-to-day activities as a leader of the institution. Some of them are high-level director generals and directors and also deputy directors. This is a very good opportunity to start influencing the way they do their work on day-to-day activities.
Challenge in health sector, the leadership crisis. It's not only in Nigeria, it is across Africa. If we don't get it right, the problem in health sector will linger.
The training will have a strong impact in the leaders that manage resources at the level of public health.
Direct our total costs, guide our leaders right. Help our youth the truth to know, in love and honesty to grow, and living just and true. Great lofty heights attain, to build a nation where freedom and justice shall reign. Amen. Thank you very much and see you tomorrow.